In December 24th, a man named Brian Thompson walked out of a Manhattan hotel and was shot dead on the sidewalk.
There was a deadly shooting in Midtown Manhattan early this morning. The CEO of United Healthcare is now dead.
The shooter walked toward the victim, appearing to briefly glance down as he lay dying on the sidewalk.
Thompson was the CEO of United Healthcare, the largest health insurance company in the United States, a company insuring 50 million Americans, a company with more revenue than Apple. Within hours, the story was global. Law enforcement launched a massive manhunt. And then something happened that nobody in a boardroom had prepared for. The public reaction wasn't grief. For millions of Americans, it was something far more uncomfortable than that.
I think this guy, if I had to guess, some guy got over. Apparently that company is really bad.
Nobody deserves to get on their way to work. Nobody deserves to get their healthcare claims denied either.
Someone said thoughts and prayers and deductibles.
In 2009, a former insurance executive named Wendell Potter testified before the United States Senate. Potter had spent years as the head of communications at Cigna, one of United Health's largest competitors. He had watched the industry from the inside, and what he told senators that day was a warning. He said that health insurance companies had turned claim denial into a science, that they tracked denial rates, rewarded employees who kept payouts low, and built entire departments around the goal of finding reasons not to pay. He called it a system designed to protect profits at the expense of patients. 15 years later, that warning looked less like testimony and more like a preview. This is the story of United Health Group. United Health was founded in 1974 in Minnesota during a period when a new idea about healthcare was gaining traction in Washington. The idea was called the Health Maintenance Organization, or HMO. Instead of paying doctors each time you got sick, you paid a flat monthly fee. The insurer managed your care, kept costs low, and in theory, everyone came out ahead. The model made sense on paper, and for the first decade of United Health's existence, it worked. The company went public in 1984. It grew steadily through the 1980s and 1990s by acquiring physician management companies, data analytics firms, and rival insurers. By the time Stephen Hemsley took over as CEO in 2006, United Health had already become one of the largest companies in America. But Hemsley had a different vision for what it could become. He wasn't interested in running a traditional insurance company. He was interested in owning the entire system around it. In 2011, United Health combined all of its non-insurance businesses into a single entity called Optum. On the surface, it looked like a corporate reorganization. In practice, it was the construction of something that had never existed before in American medicine. Optum had three arms: Optum Rx, a pharmacy benefit manager and pharmacy care services company that manages prescription drug benefits for over 61 million people, now the third largest in the country. Optum Health, which directly employed physicians and owned clinics across the United States. And Optum Insight, a data and analytics division that processed claims, advised hospitals, and built the algorithmic tools that would later end up at the center of a federal investigation. The logic of vertical integration is straightforward. If you control every step of a process, you control the economics of every step. For United Health, that meant a patient covered by United Healthcare Insurance could visit an Optum-owned clinic, fill their prescription at an Optum Rx pharmacy, and have their claim processed by Optum's own data systems. One company, every touchpoint, revenue generated at every stage. By 2023, Optum alone was generating over $220 billion in revenue, more than the insurance arm, more than most companies on Earth. The combined United Health Group reported total revenues of $371 billion that year. For investors, the story was almost perfect. The stock had climbed over 700% in the decade between 2013 and 23. The company reported a net profit of $22.4 billion in 23 alone. Analysts called it one of the best-run businesses in the S&P 500. What wasn't appearing in the earnings calls was a different set of numbers. In 2023, investigative reporting by ProPublica and the New York Times revealed that United Healthcare was denying roughly 32% of in-network claims. The industry average was around 17%. The investigations found that the company had deployed an artificial intelligence tool called NH Predict, built by a healthcare analytics company called Navi Health, which United Health had acquired in 2020. The algorithm had been trained on patient data to predict how long a patient would need post-acute care after a hospital stay. If your doctor said you needed more time to recover than the algorithm predicted, the claim was denied. United Health maintained that the tool was used as a guide, not a final decision maker, but a Senate investigation in 2024 found that United Health's prior authorization denial rate had increased by more than 56% over a 2-year period. Prior authorization is the process where a doctor must receive approval from an insurer before performing a treatment or prescribing a medication. A 2023 survey by the American Medical Association found that physicians were spending an average of 14 hours per week on prior authorization paperwork, 2 full working days every week, fighting insurance companies for permission to treat their own patients. The financial mechanics behind the denial rate are not complicated. Health insurers collect premiums from members every month. They pay out claims from that pool. Whatever is left over after claims, overhead, and operating costs becomes profit. The fewer claims paid out, the more profit retained. Every denied claim is, mathematically, a few more dollars on the balance sheet. The Affordable Care Act requires insurers to spend at least 80 cents of every premium dollar on actual health care. United Health spent 83 cents in 23, technically compliant. On $281 billion in premium revenue, spending 83 cents meant roughly $47 billion retained for overhead, executive compensation, lobbying, and profit. That year, Brian Thompson earned approximately $10 million in total compensation. The company spent more than $2 million lobbying Congress on healthcare legislation. The revenue model rewarded denial, the structure protected denial, and the scale of the company made the consequences of that denial enormous. In November 24th, just weeks before Thompson's death, a class action lawsuit was certified in federal court alleging that United Health had systematically used the NH-Predict algorithm to wrongfully deny care to elderly patients covered under Medicare Advantage plans. The plaintiffs alleged the company knew the tool had a significant error rate and deployed it anyway. Then came December 4th. Brian Thompson stepped out of the New York Hilton Midtown at approximately 6:45 in the morning. A masked gunman fired 3 shots. Thompson was struck twice and collapsed on the sidewalk. He died at the scene. The alleged shooter, Luigi Mangione, was arrested days later in Pennsylvania. On the shell casings found at the scene, investigators reported finding 3 words written in marker: deny, defend, depose. The title of a 2010 book documenting the insurance industry's tactics for contesting claims. Within hours of the shooting, stories flooded social media, people sharing denied claims. The volume and the anger of the response made clear that for millions of Americans, the killing of a Fortune 50 CEO had cracked open something that had been building quietly for years. To be clear, nothing about a targeted killing is a solution to a policy problem. Mangione is facing federal murder charges. But the public reaction revealed something the industry's earnings calls had never captured. The gap between how United Health described itself and how its members actually experienced it had become impossible to ignore. After the shooting, the political pressure mounted quickly. In early 2025, United Health announced it would reduce prior authorization requirements for certain medical procedures. Several state attorneys general opened investigations into claim denial practices. Congress launched fresh hearings. The company's stock dipped briefly in December 2024, then recovered. For Wall Street, the underlying math had not changed. The reforms announced by United Health covered a limited set of procedures. Critics said the changes were cosmetic. The AI denial tools remained operational. The prior authorization process remained in place for hundreds of medical services. The vertical integration of Optum continued to expand. The company's 24 annual report projected continued revenue growth. In 2009, Wendell Potter sat before the United States Senate and described a system designed to protect profits at the expense of patients. He named the specific practices, the denial algorithms. The claim review processes structured to find reasons not to pay. The performance metrics that rewarded employees for keeping payouts low. He warned that without regulatory intervention, the system would continue to grow exactly as designed. United Health did not create the American healthcare system. It operates within a regulatory framework that permits for-profit insurance, allows vertical integration across care delivery, and sets a floor on how little of your premium can go to actual healthcare. The company followed every rule available to it. It optimized every lever the system allowed. It built something profitable and legal, and for 50 million Americans, deeply broken. The United States spends over $4.5 trillion on healthcare annually, more per person than any other developed nation. And on most health outcome measures, life expectancy, infant mortality, chronic disease management, America ranks below countries that spend significantly less. A study published in the New England Journal of Medicine found that administrative costs consume roughly 34% of U.S. healthcare spending, compared to around 12% in Canada, which operates a single-payer system. That 22-point gap does not go to doctors. It does not go to nurses, equipment, or medications. A significant portion of it goes to the overhead of a system built around managing, contesting, and denying claims. United Health didn't fail. It succeeded enormously by every financial measure the market uses. The $22.4 billion profit in 2023 was real. The 700% stock return was real. The Optum expansion was real. What was also real was a 32% denial rate, a 56% increase in prior authorization rejections, and a public reaction to a CEO's murder that forced an entire industry to confront what it had become. A decade and a half later, Wendell Potter's warning looked less like testimony and more like a forecast.